It's already the beginning of August. Can you believe it? My kids are back to school in less than 3 weeks. I know many of you are back to school too. I really want all of you to go back to school with healthy, beautiful skin, feeling your most confident. And often acne can affect our self-confidence. I suffered from acne, this resistant patch on my forehead when I was a teenager, and I don't want anyone else to feel uncomfortable like I did. I could not even look people in the eye because I thought that they were looking at my acne spots. So let's go through some of the commonly held facts, myths, and misconceptions about acne and when you need to get yourself or your kid into the dermatologist. So acne is multifactorial. When we look in textbooks of dermatology, there are four main factors. Number one is a bacteria called propionibacteria acne, and many times acne is treated with topical and oral antibiotics. Inflammation also plays into acne. That's why some of the acne patches can get red and really angry. There's a problem called keratinization, where we actually make extra dead skin cells. That's what I had, where I had all these like hard little bumps. Those are called milia. And then the fourth cause of acne is excessive sebum production. That's a fancy word for saying oil. So many times when you're young and you're prone to acne, you have a lot of extra oil. That's actually great when you get older like me because it does keep you young, but we want to keep a balance and keep your skin healthy. So I also suffer from hormonal acne, yay. Hormonal acne can often affect women. It can affect women both when they're young, when they're middle-aged, and when they're old. And it typically presents as deeper seated nodules, often along the areas where we tend to, have kind of extra hair. So your beard area, around your mouth, things like that. Hormonal acne can be really resistant to treatment because, again, those cysts tend to be deeper. There's a great medication called spironolactone that I take myself. There are other topicals that block the androgens in the skin, but sometimes there really is a hormonal imbalance, and we can get to the bottom of that if you need to get into the dermatologist. So in terms of birth control and acne, most dermatologists are supporters of it if that acne is hormonal based. Many times the kid will actually have what's called comedonal acne, just little blocked pores. Birth control will not help that type of acne, so why put the child on something systemic when something like a topical retinoid that's prescription strength will help? So you really have to make sure that your dermatologist is classifying your acne correctly so that he or she can put you on the right medication. There are many other treatments that are actually not that talked about for acne that are super effective. I, as a dermatologist, love salicylic acid peel. Salicylic acid, many of you might wash your face with it, but when used at a higher percentage, 20 to 30%, it can actually really get down into the sebaceous glands. And for those of you with oily skin, it can purge them. It can make your scars look much better. At Tareen Dermatology, these are really affordable. They're around $100 for a salicylic acid peel. And that's a really good jump start if you want to get your skin much better. Blue light, we've talked about that before. Blue light kills the bacteria that's causing the acne. So for people that maybe can't tolerate antibiotics because it hurts their gut or things like that, blue light is a great option. An old treatment that not many dermatologists use, but we do use at Tareen Dermatology, is cryotherapy. So that uses a cold spray and it helps kind of dislodge the comedones, which are those blocked pores. So there's so many things that you can do for acne that are not talked about, that are not antibiotics, that are not Accutane. So it's really important to go to a dermatologist who specializes in acne and knows all the treatments. So in terms of acne, the most important thing is to get in early. Get in before it scars. Once your skin has scarred, it is so much more difficult, it is so much more expensive, and especially in darker skinned people like me, once that acne scars, it can leave purple, brown marks. So if your child is darker skinned and experiencing acne, get them in sooner rather than later.